Okay. This one made me chuckle. I can't believe like the magic that Dr. Afzali can do. So she's gonna show us what's called a class 3 case. It's where your upper jawbone is underdeveloped, the lower jawbone comes out in front, and it's like people say like bulldogs have that underbite. So it's when the teeth are almost flip-flopped. So she's gonna show us this case. This is a tricky one. It's hard to fix this. Usually this is you need surgery or you have braces for a very long time. So go ahead and show us your case, doctor.
Sure, absolutely. I call it rewarding challenges because it really gives me a lot of inspiration. And this is a 40 years old
Wow.
patient, and she had severe TMJ problems. She had problem articulating, and also she had hearing issues. And this is what we have now.
Oh,
And in fact, next week we are going to be removing the braces.
that's
So
incredible.
yeah, it's really, I mean, the beauty of it is that along with this change from here to here, her face is looking much better, younger, and her TMJ problem is completely resolved. And she told me early on the treatment that she was talking on the phone with her sister, and the sister said, "What happened? I can understand you much better now." So these are really rewarding things that I hear about this case. This is what her
Oh.
left side look, and believe me,
Oh.
I thought that my team got the angulation wrong, and I tried to correct the angulation. This is what we
Wow.
yeah, and this is what we have now.
Wow.
And this is the right side. And this area, she had severe mucogingival defect, and now the tissue has grown to about here. I
Wow.
don't have a picture to a capture to show you, but when I see her, has improved, and she doesn't need to have a periosurgery there. And this is what she looks like on the right. And that's basically the finale.
Wow. It's quite a finale. Oh, wow. And you closed that gap back there where that missing tooth was. Is that correct?
Yes, yes,
Oh my gosh.
yes, absolutely. That's another thing that, for her, I took a little bit longer in the treatment because she needed some implants, but I decided to make the changes and move molars into the place, just
Wow.
close the spaces for her so she'll be able to go without the implants. So yeah, we definitely were able to do that as well.
So her ears, was that probably TMJ problems?
Yes, absolutely. And when you look at, oh, sorry, when you look at this, you can see how the joint didn't really have a space and being jammed. So I opened up her vertical drastically, and I opened up the vertical from day one. As I put the braces on, her vertical was increased. Let's go to the front view. Like after the first appointment, she was, as far as the height, she was still in the underbite, but as far as the
Mhm.
uh, um, vertical position, she was pretty much at the level of the lower incisors.
So that took
So
some of the pressure off of the TMJ.
yes, absolutely, absolutely. And then when you open up that much of a vertical, then you have to, then the next step was to advance the upper jaw, which I have I didn't put it in here, but I have the picture of before and after size of her upper jaw and how it changed and how well expanded it became. And then, after the getting, it was really a rewarding process when we got into end-to-end occlusion, and then we got into a 0.5 millimeter overjet, then we got into 1 millimeter, and then 1.5 millimeters, and 2, and now we have 3 millimeter overjet, which is, within the ideal range for people.
Yeah.
Yeah.
Oh, I love this one. I love this one.
Me too. I really love this one too.
Which I think
And
is really cool because, like, I mean, I've taken a lot of classes. It's not supposed to be possible with braces, at least not doing non-extraction. So it's super
yeah,
cool. I love the cases you post.
sure. Thank you. Thank you so much. And I really love the dynamic that we have in our practices among the patients and among the team. Honestly, when I see a lot of these patients, and I have many more cases, and when I see these difficult cases, that's where my excitement is, because I see this is the opportunity that I can make a difference. I'm not saying that I don't take regular cases. I do it all the time. I even take innocent cases that they look innocent, but they are very fundamental because some functions are missing. So I take care of all of that. But the reward of, working on these cases is that the impact that it has in patients' life is
Mhm.
tremendous. And I am really uh, grateful for amazing team that I have. My team are the stars, in all my offices. They are so much on board. They really care for our patients, and it's been a really fun journey for all of us.
And what is your practices called in California?
Lifetime Dental. We have Lifetime Dental of Los Angeles, Lifetime Dental of Lake Forest, Lifetime Dental of Rancho Cucamonga, and Lifetime Dental of San Bernardino. So those are the 4 locations that we have. But I'm very active on virtually. So no matter where you are, it doesn't matter where you're located. If you have question and if you need help, I am available. And you can find the virtual link on my bio on my Instagram, which is dr.afzali. It's DOCTOR dot and my last name AFZALI.
Beautiful. Thank you, Dr. Afzali, for sharing your
Thank you.
cases.
Thank you so much. And Kimi, if you can please, because my audience are going to be seeing this, if you can share your contact information, because that's something that, I have been talking about your services to my patient and
Mhm.
giving them your information, but I would like to take this opportunity
Yeah.
they can find you.
Absolutely. So my name is Kimmy. I'm a myofunctional therapist. I'm basically like a tongue personal trainer for your tongue and your breathing, as well as like how to chew and swallow the correct way. So I help people that have sleep disordered breathing, sleep apnea, help with some of the muscle part of TMJ, people that are tongue tied, tongue thrust, kiddos that are having restless sleep. I kind of help co-manage them as a part of a team. But you can find me on Instagram, Mouth Muscle Memory, and I reshare Dr. Afzali's stuff all the time because they're amazing.
Thank you so much. Great,
Okay.
great.